So now we'll go on to part 2, where I'm going to focus more on respiratory and your GI/GU. So with respiratory, I always like to start out with subjective first, because I want to know, your patient knows the best of what's going on with their body. So ask them questions. Do you get short of breath when you're laying right here? Do you feel like you're winded? Or do you get short of breath when you're walking? You know, and how far? Can you go out to your mailbox and come back without getting short of breath? Or can you just go to the front door and back? You know, ask some specifics about their shortness of breath. Does it hurt when you're breathing? Or do you just feel winded? You know, those are the main things that I would ask them. It's just like precipitating factors as to what brings on that dyspnea so much. And of course, with all of your body systems, you're looking at your vitals. You know, I forgot to mention that in part 1, but like with cardiac, you're taking their pulse and you're looking to see not only regular, irregular, but what was the pulse? Was it above 100? Was it below 60? Know your terms there. So the same with the respirations. Check a respiratory rate. And then you're looking with that too. Is it shallow or are they deep? Are they fast or are they really slow? So you're looking at all those things when you're taking your vitals. So I've asked subjective questions. I've done some looking. I've looked at the skin again, because your heart and lungs, your heart works with everything, but your heart and lungs work really well together. So I'm going to look for different colors of the skin. You know, do I see any cyanosis? That's what I'm looking for with cardiac. And you can look in the nail beds, you know, like with the clubbing, you can look there. And you can look on their lips if you want, the mucous membranes. You know, just take a look and see if you see any type of cyanosis, because then we all know what that's indicative of. So do that with the respiratory as well. So now I'm going to go ahead and take a listen. So with your respiratory, you know, you don't want to be going too fast, because if you're telling your patient to take deep breaths and you're going boom, 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 he's going to hyperventilate. So you want good breaths. And again, go in the intercostal spaces. Start up by the clavicle, but just make sure that you know you're either above it or below it, and you just start here and then take a deep breath in and out. And then you go over to the other side, to the left side, in and out. And then you go down and across, down and across. This is just the pattern that you need to use. Down and across. So the main thing is that you're starting up by the clavicle, you're going over to the other side, because you're comparing right lung to left lung. So you're going back and forth. And that's just the best pattern to take so that you can compare sides. So I've done that all the way down. I would do the exact same thing on the back. You know, so I would have the patient sit up, and I would go down listening by his spinal column. And you're going to start at the top and listen, and then go to the other side, and then down, and then over to the other side, down, and just go all the way down. Make sure you're getting, you know your anatomy, because you want to cover all the fields and all the lobes of the lung. So you know your anatomy going down, and the same on the back. Make sure you go down to where the lungs would end. You don't need to go down further. You're not going to hear anything. So you've done the front, you've done the back. Now, one of the more important things is to get the sides. So you gotta listen over here and down, remembering how many lobes there are on the left, and then over here. Start, and you gotta listen on the actual side of your patient, listening so that you get all the lobes in there. So what are you listening for? You know, do you hear any type of wheezing? You listen for adventitious sounds. Wheezing, crackles, rails, any of those types of things when you're listening. And then you're going to chart those. Sometimes you can ask them to cough, because sometimes coughing might clear it, or it might not, and that will help as well. So I think we are okay with the respiratory status. But again, you're doing your observation, you're doing your listening, and you're asking them subjective questions. So then the last part of our assessment is going to be the GI, but don't forget about the gastric, or the urinary system. So we've got GI and the genitourinary system. A lot of times that's overlooked. So first you're going to, again, you want to inspect. All these systems you inspect first. You don't want to be touching anything. You want to look. So you want to look at their abdomen. Does it look, protuberant? Does it look concave? Or is it just flat? You're looking at, so to see what it looks like. Or is it rounded? Any type of descriptors as to what it looks like. Then we can go ahead, and then the next thing we want to do is listen. So you want to start with the lower right quadrant, anatomical. And you're going to start listening there. And you're listening for vowel sounds, if you hear any. And if you don't, then you're going to go, and even if you do, then you're going to go up, because you've got 4 quadrants. So we've got the right lower, the right upper, left upper, left lower. So just kind of going a clockwise way. Your ileocecal valve is over here, and that's why that's coming from your small intestine into your large intestine. So then that's why you start there, because that's the beginning of it. So you go up, over, down. You're listening for gurgles, clicks. They all sound different, all those vowel sounds. Some instructors may want you to count them. The main thing you're looking for is, are they present? Do you hear any type of sounds? Because that's good, because that means the peristalsis is working. So it's very important to hear them, hopefully in all 4 quadrants. But if you just find one area where you hear them the most, you can listen there, and then that will determine if it's hypoactive or hyperactive. Well, if they're just active. Active is the best. So I'd go ahead and listen. Then you could palpate. Now, and it depends on your scope of practice, as to what you're palpating for. Main thing, you're at a practical nurse level, is it hard or is it soft? You're really not listening. You're not feeling for masses, because that's diagnostic. You're just feeling, are they having any discomfort? Does this hurt when I'm palpating? And if it does hurt, I would try not to palpate there. Just go in the areas where it doesn't hurt. So if that's the main thing, is it firm or soft? And hopefully it's soft. You can ask questions about their bowels as well. Are you eating okay? How is your appetite? Are you passing gas? Do you have normal bowel movements? How frequent are they? Are they hard? Are they loose? Do you have any abdominal pain? Of course, pain with anything, you always want to ask them that. So make sure you ask them questions in regards to their GI system. And that includes their appetite and what they've been eating or not eating. Any vomiting, any nausea, anything like that is with the GI. So then we go to the genital urinary. Now mainly for that is, in your suprapubic area, you want to feel there, and what you're feeling for is if there is a distended bladder. That's the thing that you're palpating for. There's really nothing to listen to, and with a distended bladder, you're probably not going to visualize it, but you can feel it. And don't push, because it's going to be tender. Just trust me on that one. And then you just want to ask the patient, are you avoiding in good amounts? Does your urine have a smell to it? Is it really dark yellow, or is it very pale, clear? Is there any burning when you're urinating? Any of those types of questions you want to ask them. And then you yourself, look at their INO, look at their urine if you're measuring it, just take a peek at it so you can get your assessment yourself. So that's with the GI and your GU. And I think that pretty much sums up part 2 of your head to toe. But like I say, usually when you with your patients, you just start at the head and you just go all the way down. But we just did little focus assessments for this demonstration, and I hope this helps.